What is the difference of viewpoint on how you view your patients and how you view your community and the profession before EMG type of involvement of Anthony to the after EMG involvement of Anthony? So before ECS Anthony and after ECS Anthony in relation to your patients and how you approach them.
Really, after ECS, it opened up a new paradigm for me of how I view my patients. Before ECS, as a patient, I had a diagnosis. I'm going to run with this. That's how I was taught. That's how we normally thought the process went. Post ECS, I'm thinking about a lot of different things now. I'm putting together, connecting the dots. This could be this could be this could be this, adding more complex thought into my evals. It's not just a basic evaluation now. Now I'm doing an evaluation. I can understand and I can see this looks like it could be this. With the diagnostics incorporated, I can find out for myself. If we're dealing with a radiculopathy, cervical radiculopathy, for example, I can go and tease that out with diagnostics. And I'm not spinning my wheels in the mud working on a patient that's not getting better. The pre-ECS Anthony, that's what I was doing. I was like, yeah, someone might feel better if you work on someone's neck for 24 visits, but you still haven't solved the problem. Post-ECS, I understand where the problem is and I can go to it directly. It's opened up a whole new paradigm shift for me. I can understand patients a lot. I can understand their stories. I can understand symptoms, symptomology, presentation. So it's just really unlocked a whole new door of capability for me. And then when you combine, the findings on an EMG, you know exactly how to treat them. When you implement the sliding, gliding techniques, the nerve glides, and you can help them versus hurt them. I was having a conversation, with my peers about, when we do nerve tension tests. In school, we just kind of add in a neural tension test, but it wasn't very, specific to anything that we were doing. And we just were taught that that's a treatment technique to use. But there was really no ifs, ands, or buts other than just do it. Now it's like, okay, I can do the wrong technique and further injure this patient if I don't know what I'm dealing with. So with diagnostics, now I can incorporate the proper nerve gliding techniques to ensure that the patient doesn't get worse, in fact, gets better, progresses. So yes, in a nutshell, I could go on and on about this. It's really helped me hone in my skills as far as critical thinking, adding in my interventions.
I want to hear about Kevin now, like the before and after ECS Kevin. How does that compare?
When I started the physical therapy career, kind of like Anthony, we were just kind of going through the special test, range of motion, and kind of just kind of seeing what we had and kind of working with it. But through the HODS program, I really felt that my clinical decision making, my critical thinking improved. And kind of like what you said, Dimi, you meet some people along the way in the HODS program that really also help to reorganize your brain in terms of critical thinking and thinking about differential diagnoses. And with the ECS now, right now we have that ability, like Anthony said, to pinpoint problems, whereas previously you would or might just choose to do the wrong thing and use a tensioner when you shouldn't. I remember I went down to Florida with Jen, and she was really good at kind of explaining the different neurodynamics to me while we were in her clinic, and I was helping her out with some EMGs down in Florida. Just my ability to tease out problems and confirm them with diagnostics is probably the biggest difference, as well as choosing the proper techniques to treat patients after you have the findings. It's very rewarding to see your clinical thinking kind of go through that process and it work on patients. That would be the biggest difference, is that precision and that ability to tease out, versus before it might just be a little more of a carpet bomb, I guess. You're just trying to do what you can to get them feeling better, whereas now you're more precise. It's more of like a sniper rifle in one way or another.